I call this meeting to order. It is the Richland County Community and Health Services Standing Committee. Today's December 4th, 2025, 9:30 a.m. Miranda, we need a roll call, please.
Miller. Here. Kramer.
Here.
Engel.
Here.
Hendricks. Perry.
Here.
McGuire. Barris.
Here.
Braithwaite. Chicker. You have 6 for a quorum.
Thank you. And we have verification of open meetings law compliance.
Has been properly posted.
Thank you. Okay, before we go on, anybody who has a cell phone or those new Fandango glasses that record, please either put them on silent or put them away or turn them off, please. Okay, moving on down, I need a motion to approve our 14-point agenda.
So moved.
Second,
I second that.
all in favor, please say aye. All opposed, please say aye. Okay. All right, approval of minutes from the November 6th, 2025 meeting. You've all had a chance to see those minutes. If there are no amendments or corrections, the minutes from November 6th, 2025 will be approved as presented. Do we have any public comment this morning? Anyone online?
Yes.
I'm sorry, go ahead.
Kevin Hoffman, I will be making a public comment.
Okay, go ahead.
You want me to right now?
Yep,
How much time do I have?
3 minutes.
3 minutes. All right. My name's Kevin Hoffman. I am here to formally address significant violations of Wisconsin CPS policy and procedures that occurred during an investigation involving my son Jordan. These violations have not only caused severe harm to my family, but they have represent substantial breaches of state policy, ethical standards, and constitutional rights. I want the board to be very aware that unless these issues are properly addressed, I am preparing to initiate a formal federal civil rights action under 42 U.S.C. 1983. For the past 4 years, I have been the primary and consistent parent of my son Jordan in his life. I have raised him on my own here in Richland County, supported him, kept him in school, provided a stable home, and have been proud to see him grow as a Richland Center Hornet. During these years, Jordan's mother, Lainey Medina, has been largely absent. He has not been an active parent, has not supported him physically or emotionally, and has not participated in his daily life, schooling, or routines. Despite her long-term absence, I worked hard to maintain stability for Jordan, and our home life has been safe, consistent, and loving. It is important for this board to understand that Jordan and I have built a stable life together over these 4 years, and nothing in our home or daily life justified the sudden traumatic disruption that occurred as a result of CPS's actions. On October 20th, CPS arrived at my home, and without identifying any abuse or neglect, removed Jordan from my care and placed him under a protective plan. During this interaction, workers told me they believed I was doing a great job as a parent and assured me that CPS would work with me to resolve any concerns. They created a temporary arrangement under which Jordan would stay with my mother while things were sorted out. I was led to believe that this was a short-term cooperative plan, not a removal or a transfer of custody. At no point did CPS inform me that they intended to involve Jordan's mother, or they were treating the situation as an emergency. Yet, despite these assurances, CPS simultaneously contacted Jordan's mother, who had been absent from his life for years, and instructed her to travel from Michigan to Wisconsin and take custody of him. This occurred without a court order, without due processes, and without any investigation into her background, criminal history, warrants, or current CPS involvement in Michigan. What occurred on October 20th was presented to me as a supportive intervention, but it ultimately became a unilateral and unlawful removal of my son based on misrepresentation and improper procedures. Number one, false claim of present danger and fabricated supervisory consultation. Jessica Tisdale documented she determined present danger and consulted with her supervisor, Brittany Wirtz. At the moment, the safety threat was identified. However, I have security cameras in my home that indicate that she did not do this. There was no real-time supervisor approval as required. Documentation was false and fabricated, and the present danger determined was not valid. Wisconsin Safety Intervention Standards 2.2 through 2.4, which mandate immediate supervisor consultation, accurate correspondent documentation, a factual basis for present danger. Number 2, improper invalid drug testing procedures. On 10/22/2025, CPS had me take a drug test before providing the sample. I immediately noticed an object already in the test cup. I asked worker Eric which test area the bubble was touching. He said alcohol. I stated the test was contaminated and invalid. The test, unsurprisingly, returned multiple positives, including alcohol. Jessica insisted one line means negative, which is not how these tests function. The test was never sent to a lab, even though it was contested, and the cup was thrown away, destroying evidence. Under Wisconsin CPS initial assessment standards, drug tests must be valid, uncontaminated, properly interpreted, confirmed by a lab, and properly documented. None of this was done. This test could not legally or ethically be used for any safety decisions, yet it is and was. Number 3, failure to investigate the other parent or assess her safety. CPS did not conduct any investigation into the other parent, Lainey Medina. Before directing her to take custody of Jordan, he would have found there were 4 active Michigan warrants. What?
I'm gonna have to stop you there, sir.
Why?
Your 3 minutes are up.
Oh,
Do you have a lot more to discuss or just,
I got another 3 minutes. I was just going over all the policies and procedures that were violated, along with my civil rights. That's what was next. And actually, you guys could, on your computers right now, go to micourts.gov, and you could actually look at all the warrants and go to page 8 on the search results and go to Laney Medina, and you could still see these active warrants for yourselves.
okay.
But I want you guys to know that my Fourth Amendment rights were violated for procedural due process. 14th Amendment, right to family integrity. Parents have a fundamental right to care and custody of their children. CPS cannot interfere unless an immediate danger exists by supported and actual evidence and reviewed by a judge, and none of those conditions were met. Unlawful seizures of a child. Directing another parent to remove the child is a seizure, and it must be court authorized or justified by a genuine emergency. None of this was done. 14th Amendment, fabrication of evidence.
Kevin,
Yeah.
I'm gonna have to stop you, sir, okay?
All right. Well, there's more.
I know there's more, but we only allow 3 minutes, and I will allow a little overtime, which we have done. So, we thank you for your comments. Have you, sent that letter to anyone that you're reading to us today?
I will be, but I wanted you guys to be aware of it.
Okay, all right.
That's what I was gonna ask.
Yeah.
Send that in.
Go ahead and send that in, please.
To who?
Send it to.
You guys?
Yeah, you can send it to us to start with, and we'll make sure it gets to the correct people.
Okay. I will be sending it to the DCF state people too. The bros complaints.
Well, we won't see it unless you send it here to Richland County government.
Okay. I
Maybe
wha-
just send
one
it to
other
the,
thing is that I want you guys to be aware that when I went to Ypsilanti, Michigan to pick up Jordan, my son, just 2 weeks ago, I was in front of the police department and they showed me a piece of paper, and under it indicated that I have it, but it indicates that I was negligent. Now, they had to do this because I mean, during this whole interaction, they have not indicated I've been negligent or nothing. So they fabricated evidence, they fabricated paperwork, make me look like I was negligent, creating false documents and misleading statements.
okay.
I mean,
Kevin,
these are all should be huge concerns.
right. I understand your frustration, but we got to start with the letter that you have written today, which was done very well. Your best bet is to send it to the Richland County Administrator, and she will ensure that it gets to the proper individuals.
All right,
Okay?
I'll do that today, right
Please,
now.
yes, please do that.
All right, thank you.
You're quite welcome, sir. And you're more than welcome to stay for the rest of the meeting if you wish.
I'll hang out.
Okay, thank you.
Thanks.
Any other public comment?
As a new committee member, I'd like to say I'm against public comment online. School district doesn't allow it. The city doesn't allow it. I don't know why the county does, but I couldn't understand a thing he said.
It was hard to do,
And what's the point?
you know.
They need to come here.
All right. So,
That's just my opinion.
Rod, can you put that on the agenda for the next county board meeting?
I will.
Yep,
Can we get the rip? When he says it?
when he said, if we could get a copy of that, yeah, she's gonna send it to the judge.
Okay.
It's really nothing we can do in situations like that, just to go through the proper procedure.
Yeah.
So,
And for the online public comment, that would have to go through rules of the board. Part of committee on committees and changing the rules of the board. So that can be something that we can make note of to discuss when we update the rules of the board.
yeah, that's what I was thinking for Rod, for future agenda items. They could bring that up at that. Sure. Get that in the process, at least for review.
Just one thing off agenda here is for public comment is tomorrow, if you have a sweet tooth, starting at 9 o'clock through, I think, 4, right over across the road at Richland County Bank. The American Legion Auxiliary from town here is having a bake sale. Pies, breads, candies, cookies, you name it. And it'll be right there in the big hall there, the first part as you walk in the bank. So make sure you get there. I know there's gonna be regular sized pies, like 8-inch, 9-inch, and there'll also be little pies. So one of those ones you can take and eat for lunch just all yourself. Those are the best. Okay, moving on, we are gonna have Health and Human Services Director Administrative Report.
That's me.
That's you.
Okay, great. So in your packet, you have the summary, the breakout of all the different unit updates, just in summary, ADRC and the great summary on the different activities they've had and will be having. Richland Center Rotary Lights, the trips that's coming up to take people there, the Rise and Dine. They had one already. They're doing another special Rise and Dine at the Community Center. Great work there. The next big update in the behavioral health services unit. We have a new behavioral health unit manager. Very excited to welcome Tamara Olson. She comes to us with a background in AODA, big background in AODA, some criminal justice background, works with in corrections for years. So I'm very excited about what she can bring to that unit and her experience that she has with helping people with AODA issues and all the work that they do in that unit. I keep saying AODA, but she can do other things too. So, yeah, I'm not gonna make her speak. I'm not gonna be that. She'll speak at some point in time. I'm sure I'll have her present something. Child and Youth Services. As you can see, youth justice referrals are up, but on the good side, our actual out-of-home placements are fairly low, so that's always a plus. Economic support, they still excel in beating benchmarks. And since last month, the federal government has reopened, so people are getting their food share and all the good things that way, so that's great.
Are people gonna get energy assistance now?
We don't do energy assistance through us, but from what I understand, they're still doing application. They're taking applications, they're taking all the things. So whether or not the benefits are there to issue, I'm not really sure. That's not something I do know that they're doing applications. So
Who's?
it's through Energy Services Corporation. I think they have office hours at the auditorium. They rent some space in the auditorium and have that. Yeah, so
And you can go online and do this.
you can go online. Yep, for sure. So, yeah.
Thank you. Sorry to interrupt.
No, that's okay. That's okay. Yeah, we haven't done that program in, gosh, 4 years, I think, at least 4 years. So
I'm just wondering
So,
because
I don't stay
they
somewhere.
used to get it automatically. And now this year, because of the government shutdown,
Yeah.
there's nothing.
Well, I think historically that particular program, they occasionally have until they actually have the state actually has the money in their, in the bank, so to speak, they don't actually issue benefits. And usually there's been delays historically on getting those out. It's December. I haven't heard. I see Roxanne turned her camera on. Does that mean she has something to say or no?
So we had Energy Services come to an ADRC unit meeting. So they are doing applications right now. They have not received the funding yet, but they are doing applications. One thing to note is people can walk into their office, which is over at the auditorium building, which is 3rd floor. The phone number, even though it's a local number, it does not ring to their office. It goes to like a staging area and like an answering service. So people are not getting calls back right away. They are addressing those calls as soon as they can. But if somebody's needing hands-on assistance, what we were told is that people should just come into the office and they will assist them at that point. So there is no way for them to physically call the local office.
What about some of these people that are housebound and can't get there?
So
Because-
so those individuals, they can do phone interviews, so they should still call in. If they can do it online, that is always preferred now at this point. But if they do need that assistance, they need to call the number and then leave a message. And then the one thing is that number, when they're getting a call back, they're supposed to get a call back within 24 hours, but they are so inundated with calls. It has been a couple of days, she said. But she said the hard thing is that many people have spam blockers on their phones now. And so sometimes they're not able to get back through to them. So then just even if they could have somebody go into the office, they, for the most part, aren't doing paper applications either, but they can do phone interviews as well. So, yeah. And so the other thing that we've told people too is we actually had somebody that had that issue. And so then our staff here was able to facilitate with the person at Energy Services to get them connected. We don't do a lot of that, but it is something that we were able to do for somebody.
Thank you.
You're welcome.
Thanks, Roxanne. Yeah, and then finally, public health. As you can see, they're doing their usual health and wellness promotion, getting out in the community, talking about different things. Flu shot clinics in the schools have been done. So yeah. Beautiful disease update, respiratory viruses are low and stable. So yay.
It's good. Yes. Thank you. All right. Moving on to the vouchers and expenditures.
Yes. So for this reporting period, we processed a total of 67 vouchers across 3 categories: volunteer driver expense reports, 2025 prepaid vouchers, and purchasing card transactions. So in total, our expenditures in this range came to $43,793.56, and all items align with normal and expected program operations for this year. There were no unusual or out-of-pocket expenditures to report, or I should say out of policy, excuse me. All vouchers remain within their respective program budgets, and we all were reviewed and approved according to county financial procedures. I'm happy to answer any questions regarding any specific vendor or transaction items if anyone has them.
Moving on to C, budget summary and Richland County placement report, please.
Yeah, so for the budget summary, the department's overall budget utilization for October was 77%, with total expenses of $6.81 million against our approved budget of $8.87 million. After applying anticipated revenue and the annual chargebacks, our adjusted budget balance is projected to close the year at approximately $125,864 in the positive, so yay for that. Overall, departmental spending is aligning with projections and program operations remain stable. We continue to closely monitor the areas with greater fiscal volatility, specifically CCS, children with disabilities, and institutional placements. But at this time, no significant budgetary concerns are emerging. Revenue trends remain consistent and cost pools are tracking just as expected, and we do not anticipate any end of year deficit.
Thank you.
Yeah. For placements, I have through October, adult placements remain within expected ranges, so that is great. Fund 54 is 53% utilized with a remaining balance of approximately $331,000. Institutional utilization continues to fluctuate month to month as it does. But overall, county expenses remain stable due to a combination of reimbursements, and we've also had an uptick in shorter stays in more recent months, which has been advantageous. Child placements under Fund 54 are 47% utilized year to date, with $359,862 remaining. The most significant costs continue to come from institutional and treatment foster care, while detention usage has remained low and predictable. Case volumes this year have also remained steady with no unexpected spikes in high-cost placements. So overall, the placement activity is stable and both Funds 54 and 44 are positioned to remain within budget for the remainder of the year. Any questions?
So if a child is removed from a home, does the CPS get money from that then?
I'm sorry, what was the question?
So if a child is removed from somebody's home, does the county receive, or does the CPS agency receive money for that?
No, they don't. In fact, it costs more money for us.
Okay.
Thank you.
Thank you.
Item D, 2026 revenue contracts.
This is something that we do annually. We just kind of report out on some of the different contracts that we'll be signing, or have already been signed so that we can operate in 2026. Nothing really to do with these. It's just a report out. You can kind of compare where our revenue is from last year to this year. And these are revenue sources, that we receive, from different entities like the reimbursements for income maintenance, the Department of Children and Families, DHS, for all the various programs. So when we talk about in our budget, all the different allocations we get, the state and federal funding, these are the different contracts that we sign off on. So that offset the need for any tax levy. So as you can see, revenue's a little bit down, but it's nothing that's concerning as far as where the contracts actually are going to land. It should be good.
I see inclusive is down a little bit.
A little bit, because we looked at that kind of the average of what have we actually received for revenue in the last couple of years. And so this was just a truer expected revenue from them. And that's what we included in the budget, was that the 9.488. Yep.
Item D, quarterly contract monitoring report.
Sure. So what we do quarterly is we kind of give you guys an update on where we're at with some of our different provider contracts. Because we want to, if we look like we're going to go over that amount, then we have to do amended contracts. So it's just something that we've done over the years to report out. So like for Arneson Counseling, we're billed through August, but we're already at 79% for August. So obviously we're trending high for that. Provider Diane's Adult Family Home, that provider as well. is running high. Both of those providers are our comprehensive community services providers. And so those expenses are 100% reimbursed through that.
Hmm.
But yeah, so what'll happen is we'll kind of keep an eye on those, and if we think we're gonna need to redo those, we'll, depending on the amount now with the new procurement policy, some of them might get brought back to you, some of them might not. But you guys still like to know kind of where we're at with our providers, so. Some of them you might see that are really high, like if you go a couple pages later, you got like Bakari, that's 99%. We don't have anybody there right now placed there, so we're not even using them, so we shouldn't go over on that one, as an example.
Then you got one here in May, Shea Rehab,
Yep.
Psychological Services.
That's the same, that's another one that we're not using that provider anymore, the contract lapsed mid-year on that one, so that one would be good on.
All right. Item F, quarterly review of organization charts.
That's also out in the packet. In the administrative and financial services unit, we do have a vacant secretary position that we're posting, and then we brought on Emily Bernstein. She's our new fiscal specialist, so she replaced Nikki Chitwood, who had been with us for several years. And then now we have a vacant secretary position that we have, what's actually currently posted. In the ADRC, it's pretty status quo in the ADRC. That's a pretty solid department there. All those names are the same as last time. In the behavioral health services unit, the biggest name that we'll see in there is Tamara Olson, which I introduced you to her earlier. We do have, I know our mental health therapist position is still vacant, continues to remain vacant. We've had some hit or miss application, a couple of missed applications, but hopefully they're good ones, but sometimes you have to just kind of move on. But that's always out there. Our recovery services coordinator, that position is vacant. We do not have that one posted yet, but hopefully soon we'll do that after the first of the year. Otherwise, at the time of this report, trying to think who would have been new from last time. Amanda Harvey would be new from last time. Jenna Curtis is new from last time. And let's page here. The child and youth services, it has 2 vacant CPS positions. We have filled one, as of the time of this one, the person hadn't started, but we have Casey Banker starting next week. So that one will be filled, and then we still have another vacant one out there. No, actually, we don't. We have Aaliyah Ruland. We missed that one, so that will be all filled come Monday, so. Yeah, hey, I know the child and youth services supervisor that says vacant, that is one of the positions that we just changed to a lead position for 2026. So we'll fix that. We'll update that the next time around. And we haven't yet started looking for filling that position, so. Economic support, they did just, that should be all full now. They just added John Ellison and Christy Perez, so they're in their training. So that's exciting. So that unit is full right now. And then the public health unit, we've got Brandy, her 2 public health specialists, and then Betty Nye comes and helps us out with our clinics, and I think she does all our TB skin test readings and things like that. Any questions?
Hearing none, we're gonna move on.
I wanted to point something out. So when you go down to the Health and Human Services building and you look at all the postings that are up, most of them are structured towards mothers, single mothers, helping single mothers. And there are single fathers in Richland County that take care of their kids by themselves. And a lot of it just is pointed at helping mothers and helping women. And I've struggled with this for years with trying to get help from these systems and these agencies, and it's kind of difficult, to be honest.
When you say postings, are you talking about like program flyers, posters?
Yeah,
or
so like all the
our
flyers
lobby?
that are up, yeah, all the flyers that are up, you got like your pap smears, you got, like it's just all like, I feel like it's more towards helping out women and single mothers. And like well, I've been there many times and I look at the flyers all the time, and it's like there's no flyers for helping single fathers.
Okay, thanks for clarification.
Item G, Pine Valley Community Village Administrator. Brittany, you're up.
All right, so average census for November was 69. ALF was 16, so full on the ALF side. Medicare, we had an average census of 7, admission 7, discharges month to date was 7. Kind of like the summary of it was, we had a lot of respite stays in November. A lot of residents coming in for 5 days, maybe maximum 7 days, and then going home, just to kind of get that relief to caretakers. We did have the state survey on 10/21 on the SNF side, and that was a complaint regarding staffing, and every complaint was unsubstantiated. So no citations, nothing. We were perfectly fine and well within our areas. The ALF was they're biannual. So instead of like the annuals that SNF has, the ALF only goes through a biannual, and they came in on 10/28 and we had no citations. That was a perfect survey. So on the SNF side, there was complaints regarding staffing, and then apparently a complaint came in that our aerosols or like deodorizers cause pneumonia. Obviously that is not true. And so those were investigated. The assisted living, during the biannual and talking to the state surveyors there, they thought the staff were extremely well educated. They were consistently educated on things. The residents were well cared for and happy. So for our QAPI, so it's our Quality Assurance Performance Improvement Committee that we meet with each month with medical director, pharmacist. Everything's going well. We're really focusing like on commission documents, making sure those are going really well and have been approved. Fall procedures, we've been really bringing therapy involved with, all falls, just kind of doing a rehash of every resident, and just making sure we have all the necessary things in place. We brought in a new home care physician, and we're really, really excited. They do a lot of things at bedside to fix wounds like pressure injuries, things like that. So we're super excited. He started this Monday. So residents are really excited. They can do debridements, they do misting, they can do all kinds of things at bedside. So, and try to make it as comfortable for them as possible. We also partnered with Gentel. I'm not sure if anybody's familiar with that, but we just signed the contract with them. Essentially all of our wound care supplies will go through them and they bill Part B. So there's no cost to our wound care supplies. Maybe some supplementals here and there, but essentially we're removing the cost of wound care, which is thousands of dollars a month. Readmissions, we're trying to eliminate or the readmissions to hospitals. Obviously we have unavoidable ones, but essentially we're just trying to eliminate, the need for readmissions to hospitals. We just did a fire safety skills fair in November. We're also continuing that on here in this month to ensure we get everybody. So essentially they're all playing with fire extinguishers outside and putting a fire out. So that's been really nice a lot of the staff members have been excited about being able to utilize a fire extinguisher and how that works and how to put a fire out. So they've been really excited.
Are they actually gonna be able to go out and try it out?
Yes, they have been. So we
Good.
did it. They actually, all of us, every single one of us.
Okay.
This is an all staff requirement for the state of Wisconsin and the federal requirements that we go out and we practice with a fire extinguisher. So they're live fire extinguishers and they get to learn how to pull, aim, squeeze, and sweep,
Yeah.
right?
Yes, at the base, yes.
Yes. So our new food vendor started Monday. So we're starting to order from there. I've signed the menu, which is the menu and our trade tickets, which is free to us with this new food vendor. Annually, we'll save about $20,000 on food cost. And we have a lot more availability with this new food vendor for making residents happy. We just met with residents yesterday and just kind of had this huge meeting with several, and I mean, a lot of residents, and we're excited for the future. The plan is to really start honing in on the food production and making sure those complaints stop. Obviously, we won't make everybody happy, but at least we can try to make majority of everyone happy with foods. Trying to think if there's anything. Oh, we do have the holiday tribute tree. So if anybody's interested coming down to snag a resident off the tree to buy for, that is available. And it's right as you come into the building, and it's off to the left. So there's like little candy canes with name tags on them. So if you would like to join in on that, we are welcoming anybody and everybody. We set up a staff kind of like a food pantry for them downstairs. So we've been taking like dollar donations and putting up food, especially, you know, with the food stamps that was on hold and people being able to access money to pay and get food for their kids or their families. So we put it up downstairs and it's been utilized quite a bit. We've done personal care products, food, clothing, you name it, it's down there. So staff have access to that. We did have 3 self-reports in October and November, and self-reports, I mean totaling on ourselves for things that haven't been up to par. So one of them was a family misappropriation. It wasn't a staff member or anybody's staff involved. It was an actual family member misappropriating their mother's funds. Missing money was out of the building, and then we had a intentionally not following care plan and intentional neglect. So those were reported, and then a resident complained to CARES. So
Complained of what?
CARES. So it, you know, if they're not satisfied or whatever, if they feel something was less than par, we self-report, we tattle on ourselves so that, you know, we put things in place. We do an investigation, and one of the investigations, because of the intent of it, and because we have to determine, was something intentional, was it not intentional? And when intent has been determined, obviously licensures go into effect of whether or not the state is going to impose those. So I recused myself from that investigation, and just because of, you know, the situation itself. So that was done with Trish and Mike. They did the investigation for me and then kind of went from there. ALF, we're really excited. We actually are partnering with a guide. So essentially it is a CMS program that has better outcomes, better stuff for dementia patients. It doesn't go over to the SNF side. Unfortunately, this is kind of like that self-care, but it provides excellent stuff for, you know, their respite stays, for their caregivers who are coming in, seeing them, gives them additional money to care for their family members a little bit more, and just specialized cares, specialized services. So we're really excited about that. And it's something that's implemented through our therapy. It's free of charge. They come in, they do everything. So a lot of free programs we're accessing this year.
Any questions?
You mentioned intentional neglect. You kind of elaborate on that?
I can tell you, like, when we do an investigation, we have to determine, was there a source, was it intentional? Was this done on purpose? And when we determine that it is done on purpose, then we have to take action. So I can't elaborate, obviously, due to the fact that it's employee rights and they have the right to privacy, but just kind of a generalized, you know, determining that there was intent. So there was intent to neglect.
Mary?
What's the nurse situation down there now? Are you full?
Working on it. We, obviously, the new wages will be coming out in January. And that's one of the agenda items here is the final nurse wage is what we're hoping to get approved today to county board. So a lot of it's the turn of the wages at this time.
So you're really not short staffed?
No.
Do we still have people coming in from outside?
Yes, we do. Luckily, we have the consistency with, so like Great Tree, we contract for several weeks. And then we have the ability to continue their contract, and the 2 nurses that we have from there are fantastic.
Are they 13 weeks?
12 weeks, 12 to 13, and then we're extending, I know Brooke. But we have had absolutely no complaints from the residents in regards to the cares and the nursing staff that are coming in. So that always makes life a little bit easier to have the same ones coming in.
So my question is with the wound care person, is how many hours is that person gonna have? Like, is it?
No, so they bill Medicare B, so this is a free service for us again. So they come in, provide that wound care, get those assessments for us, and then it's a physician, so he's a general surgeon and he's a vascular surgeon, so it just kind of adds the added benefit to ensure that like the wound care is starting to resolve. So like we do have stage 4 pressure injuries, or we do have like these things that just don't want to resolve. So just that added protection that, yes, we have nurses, but they're not physicians to make those orders and make those changes. So they come in.
Basic skin tears and stuff.
No, unless it doesn't heal, then we would bring it in. Like
So
if-
the nurses are still responsible.
Correct. They would notify the physician of that change in condition and then get what they want. And it's usually like steri strips or something simple, but those ones that aren't healing or pressure, you know, have all that, that's where the physician comes in to help heal those things and try to prevent further.
So
deterioration.
like how many, like we got med aids now, medication aids, they can't do anything but meds, correct?
No, that's incorrect.
Pardon?
That's incorrect. So they
What all
can,
can they do?
so they can pass meds, they can give insulin, they can actually do the, redress a wound according, so anything that's ordered by a physician, they can do.
I guess I'll have to look at that job description.
Any other questions?
Guys, have a quick one. Which vendor did you guys go with out there? Pardon?
For which vendor?
The food.
Performance Food, also known as Reinhardt,
Oh, sure.
what was known as Reinhardt, yeah,
Soon we have before this though.
Martin Brothers.
Oh, yeah.
Thanks. All right, now we're gonna move on to number 8, discussion and possible action. New starting wage for licensed practical nurses.
Yeah, so when I was reviewing wages, just kind of coming in, we had some discrepancies on like the starting wages of certain like, licensed staff. LPNs were at a very low wage, starting out, so we recently were able to get this kind of reviewed all over again with new job descriptions and just kind of the expectations. And we figured that they do in fact need to move up. Is it 1 grade? Was it 1 or 2? It's either 1 or 2 grades, to step 13. So this is more in line with the market, for starting wages for LPNs.
What is the starting?
Currently it is $25, and it will go to 27. I have to look. I think it's like 27 something. So,
Motion to approve.
yes.
I'll take it. Rod, you're gonna do second?
And I have a comment.
Yes?
You gotta pay your people.
Absolutely.
Correct. Gotta pay with their word.
Now, will this move on to county board?
And this is,
Tuesday, right?
yeah, Tuesday. So this is one, just a little background. You'll notice, if you remember, in October, we took a whole bunch of positions to the full county board. This one wasn't on there because there was more research that needed to be done and more discussions with Tessa. So that's why this one is now coming back.
Good. It'll be fine. All right, moving on to number 9, discussion of possible action. I'm sorry.
Madam Chair,
Yes.
you have a first and second on that, are you?
Oh, I'm sorry. All in favor, please say aye.
Aye.
All opposed, please say nay. It has passed. Motion is passed. Now we're going on to item number 9, discussion possible action, updates to the Pine Valley addendum.
So recently we changed, or the county changed the, holiday. However, we ended up getting one too many holidays. So we are asking to remove the Veterans Day holiday as a recognized holiday for Pine Valley and to update the addendum to remove all of the holidays and go and just put it in their C county handbook.
Oh, okay. So you'll have the same holidays as everybody else then?
Our holidays are listed in there a little bit different than what everybody else has, due to healthcare. So the plan is to just use the book because it's going to have what our holidays are listed under for 2026.
Motion to approve.
Do I hear a second?
Second.
Thank you. You have a first and a second. Any other questions? Hearing none, all those in favor, please say aye.
Aye.
All those that do not agree, please say nay. Hearing none, motion is approved. All right, number 10, discussion and possible action, resolution approving provider contracts for 2026 for the Health and Human Services Department.
Sure, so, for 2026, we have a handful of providers for some of our different programs. These are all, one is for the Child and Youth Services Unit, and the other 3 are actually Comprehensive Community Services, CCS, providers for CCS program. The reason these have to come through you is because of the amount. Anything over $250,000 or greater has to go through county board. And so these are contracts and the amounts that we're anticipating having to spend with these individuals, or in these individual.
Do I have a motion to approve? Elaine, second?
I'll second it.
Okay. Any questions, discussion? All those in favor, please say aye.
Aye.
All those that disapprove, please say nay. Hearing none, motion is approved.
Chair,
Yes, ma'am.
I missed who you recognized as the first.
Elaine. All right. Number 11, discussion and possible actions, approve changes to fee schedule.
Yes, I was asked to, actually annually, we're required to approve our fees for the coming year. It's a requirement. So we have to do that annually. So we, each manager reviewed the different fees for their different services in their respective units. And the only changes we are going to make is we are going to, we'd like to update our suggested donations for our nutrition site, going from $4 to $6 a range that we're asking. So that's the only thing that changed. All our other services were the same.
Do I have a motion? Approved by Rod Perry. Second? Mary? Any other questions, discussion? Hearing none? Motion's been approved. We have any correspondence?
I will get Kevin's added to the package. You could send it to me and we'll add it to the packet after we meet.
Okay, thank you. Did you hear that, Mary?
Oh, that's when I answer.
Any future agenda items anybody would like to see?
Henderson will be opening up a mental health urgent care unit in 2026. Actually in La Crosse. So that should cut down, expenses for the county, but I'm just wondering whether we should, just want to put that on the agenda and get people in touch with that. Because that's a key resource. This new,
Saw like on a newsfeed or something.
Anybody else want any other future agenda items? And our next meeting will be,
It's in Arizona.
is it?
It's in Arizona.
Next meeting in Arizona. Is, what is that, first Thursday, January?
First. The first.
Oh, we ain't meeting that day.
I was gonna say, but we won't be there. We'll be on holiday.
How about the 8th? Is that okay with everyone? I have a question. Has it always been 9:30? Yep.
Thought we changed it.
Well, it was at 9 o'clock and then we changed it to 9:30.
I think we had it later for some reason and we.
I think it was later because of COVID, where they're like morning,
Yeah,
first morning
we
COVID.
had committees and things earlier, so.
Well, I was just wondering if, you know, anybody has a problem with the morning meeting or if you want to move it to the afternoon if possible.
Do you want to have that as an agenda item next
Yes,
month?
please. And we can see, discuss it. I'm not a morning person. All right. Any other future agenda item?
Yeah.
Ellie?
So we're having the meeting on the 9th.
8th.
The 8th.
December 9th is the full county board meeting,
Oh, what?
but this next meeting would be the 8th.
January 8th.
So January 8th,
Mm-hmm.
that's 2025. Never mind.
That's a Wednesday. I'm coming out.
All right. There's no further questions or anything anyone else would like to ask. I need a motion to adjourn.
I would just like to say if you guys could all please just take a look at my statement and please
We
go over it
will.
and read it. Thank
Right.
you.
I need a motion to adjourn. Mary and Larry seconds. All those in favor? Aye. All those opposed? As a friend of mine would say, you may stay. All right, thank you.